In this video, we are going to learn about EEG, that we all know is electroencephalography. And what is electroencephalography? It is a recording of electrical activity of the brain. So we are recording the electrical activity of the brain. Now 2-3 questions. First, who is the inventor of this? The answer is, it was invented by Hans Burgers in early 20th century, exactly 1902 something. So Hans Burger. So in fact, there was a question in AIMS exam. It was कि examiner want to ask a first year MBBS student कि who invented the EEG, and the student was not able to recall, and then the examiner said something you eat at McDonald's is a hint. So the student said McDonald's, burger. He said yeah, now burger. So that's why if you remember from burger the name of burger, that is called as priming. So burger help you recall burger. So that is burger is an example of priming. That is, you prime your brain to a stimulus which is similar, and that will make you remember the name burger. So that's why burger make you recall. So name priming is a recall method. So that is called as Burger. Okay. Now Hans Burger recorded the EEG by placing the electrodes over the scalp. So how to record it? It is recorded by placing recording electrodes over scalp. Now we can directly place over cortex also. If you place over cortex, is called as electrocorticography. Then it become electrocorticography. But it's an invasive procedure, so obviously electrocorticography. Maybe if Elon Musk invent or rather bring his Neuralink, you know the Neuralink project where they are trying to put electrodes on the brain and connect it to the computer interface, and then you can control the machine just by your thoughts. Okay, so you don't even have to type message, you think and the message goes. So it's very similar, electrocorticography. Okay, now comes the question. Question is, what is the electrodes record? And it could be different numbers, like it could be, and where the location they are put over the frontal, the parietal, temporal. Okay, and where they are put over parietal, temporal, then central part, occipital, etc. That's why we give the name as like P1, P2. So that means they are put over various areas of the cortex, frontal, occipital. Now what are the number of leads? They could be 16 or it could be 32 leads also. So 16 or 32 leads. Now question is, what is the source of the electrical activity? So the source of the current. So basically the source is, yes, the fluctuations, you have fluctuating dipoles. Fluctuating dipoles. So fluctuating dipoles at dendrites of cortical neurons. So 2-3 question. First, what is the source? The source is your cortical neurons and it is their fluctuations. Okay, the dipoles or the fluctuating dipoles, they are the responsible activity. Are you clear? So fluctuating dipoles in the cortex are the responsibility we are seeing or we are having. Are you clear? Now comes the question, what is the basis of the EEG activity? So remember, very simple rule, brain activity is proportional to frequency of the waves. So in simple language, more is the brain activity, more would be the frequency of the wave. Like example, a person who's in sleep will record a low frequency, and an awake person or doing some activity will record a high frequency. Are you clear? In fact, if there are abnormal activity you can detect in like epilepsy and in seizure disorder, it is the IOC. Which is IOC? Yes, our EEG is the IOC for the seizure disorder. Okay, let me give you some patterns to remember. Okay, like example, they might ask you 3 hertz wave and spike pattern. So if they ask 3 hertz wave and spike, it is seen in absence seizure. If they give you 4 to 6 hertz poly wave and spike, then it is what thing? It is your myoclonic. So it is called as myoclonic seizures. Example is Zayn syndrome. Then you can also see a very special pattern called as hypersrhythmia. That is an infantile spasm. There is a high activity without any pattern, that is called as hypersrhythmia. High voltage, high frequency, irregular activity is infantile spasms. So these are some of the abnormal patterns of EEG that you can see clinically. Now, if brain is becoming less active, the frequency will fall. So that is why decreased brain activity cause decreased frequency of EEG waves. Example, hypoxia. The brain is not getting the oxygen, so obviously neural firing will decrease. Hypothermia. Then there is also what? So hypoxia, hypothermia. Also what else we see apart from the hypothermia? Yes, there could be our hypercapnia. Now there is a mistake. People think hypoxia and hypercapnia. Remember, they suppress the brain activity, whereas hypocapnia is excitatory. If they ever give you hypocapnia, understand it is excitatory, not inhibitory. Hypercapnia is inhibitory to the brain. Okay. Then we also have what? We also have our inhibitory agents. Like example, a person is having drugs which are example benzodiazepines. They can suppress the brain and cause low frequency wave. Okay. Then any coma or even general anesthesia. So general anesthesia again causes a decrease in the frequency of our wave. So these are all condition causing low. In fact, in GA, we use what? EEG as a tool to assess the depth of anesthesia. So that is why EEG used to assess depth of anesthesia. This is called as bispectral index. So they ever ask you what is bispectral index? The answer is it is a method used to know whether the brain is sufficiently in anesthesia or not. So that is why these are condition causing very, very low activity. Okay, abnormal activity disorders, we can see the conditions like which one? Like our 3 hertz, 4 to 6 hertz, or hypersrhythmia is an infantile spasm, or we can have burst suppression patterns, multiple type. Okay, And one more thing is, in encephalopathy, especially metabolic, you will see delta waves. So one more thing, they are low frequency. So delta wave is seen in metabolic encephalopathy. Encephalopathy. Now the waves are classified on the basis of their frequency and amplitude. On basis of frequency and amplitude. Now what is superior? That's the question. So frequency or amplitude both are used, that is in microvolts, that is in hertz. But frequency is the main criteria. If they ask you to, I will go for frequency. Main criteria is frequency. So let's discuss that frequency issue. Okay, let's discuss. So very simple concept we see here is, let's say we have a time window of 1 second. This is, let's say, 1 second. 1 second. And we count the number of waves. So look at this. So how many waves are there? 5. So there are 5 waves in 1 second. So that become 5 hertz. Very simple logic. Okay. Now what can happen? Now imagine in the second scenario, what happens is, look at this one. Here, let's say I make the frequency change. Now there are how many waves? Only 4 waves. So the decrease frequency to 4 hertz. So EEG is one of the easiest investigation. Just count the number of waves in 1 second. That will give you the value in hertz. And hertz is the unit for frequency. So that is what is called as the frequency of your EEG waves. Okay. Now let's discuss the main important EEG waves. So I'll make it easy for you so that you don't ever forget. First, awake person show 2 main EEG waves. So what they are? Let's discuss that. One is alpha wave and other is beta wave. Now how to remember them and recall? First, remember the alpha wave is, first question, is seen in a person who's awake but doing almost nothing. So you can say at rest. At rest. Okay. This is busy mind. Busy mind. So now remember the technique I am teaching you, that if they ask you, so remember what is the wave. So if they say busy, busy is beta. Busy, beta. And at rest, if you say in Hindi, aram. Aram hai aankhein band, that is alpha. Alpha is aram. So how do you get the alpha wave? Like you are traveling and your eyes are closed, you're sitting like this, you're not talking to someone, you are in alpha wave. So eyes are closed here, then there is no disturbance. So you are in a place where there is no sound, no noise, no disturbance. You are completely at peace. Can be like yoga. Okay. And there should be relaxed mind. Relaxed mind. That is, it should be free. So free and relaxed. You can add the word free also. Free and relaxed mind. And there should be no disturbance, no thinking, no tension. When is the exam next, NEET, what? No tension. Relax. Okay. Bilkul Baba ban jana, just like you know Baba. Here, the moment you open the eye opening. The moment you open the eye, your brain become active and now it start processing the information. Then sensory stimulation. So let's say some very boring subject class is going on, okay, and teacher see a student taking alpha wave. He's not sleeping, just taking alpha wave, eyes are closed and like this. Suddenly teacher says, hey, you get up. The moment teacher shout, the alpha wave are disturbed, and what takes over? The beta wave takes over. So that is sensory stimulation. And active thinking working mind. Active thinking working mind. So that means when you close the eye, you get alpha. So that's I'm telling you the word, keyword. Eye close alpha, and when you open the eye, beta. So anything which make your brain busy processing the information, like right now, which wave you all would be having? Beta wave, obviously. Suppose if you sleep by starting the lecture, then you sleep, then it will be some other wave. I'll discuss that, theta, delta. But right now, you all must be having the beta wave. Okay. That is why Hans Berger, he demonstrated that when you close the eye, frequency decrease. When you open the eye, frequency increase. That's why he gave the name. What name? The alpha wave. He called as the. He not called, but rather it was called as Berger wave. So alpha wave, sorry. So alpha wave is also called as Berger wave. Beta wave is called as what? Beta wave. So beta wave is called as which wave? Beta wave. So beta wave is called as, yes, it is called as alpha block. Why alpha block? Because the moment the beta wave come, alpha wave are gone. That's why called as alpha block or desynchronization of EEG. Desynchronization. So what are the two names? Alpha block or desynchronization. Now what are the frequency? So is the frequency. So alpha wave. So morning lecture start 8 o'clock, and most of us when we are in morning lecture, we are just pretending to be attentive, but your eyes are closed, you're not paying attention. So 8 o'clock lectures till lunchtime, 8 to 13 hertz. Whereas beta wave, now your mind is more active. So beta wave is 14 to 30 hertz. So remember the frequency, 8 to 13 is alpha and 14 to 30 is the beta wave. Are you clear? Done? Now comes the question. Okay, so are you clear? So beta wave. Now we see sleep. Okay, so sleep has multiple stages which we'll discuss subsequently, obviously in the next lecture. So sleep has basically two main things. One is light sleep and deep. Now what do you mean by light? Light means easy arousal. Okay, and we see theta waves. Deep we see delta wave. So first let's remember them using my technique. D for delta, D for deep, and D for dead. D for dead. He look like dead person. So what is the person who look like dead? Doesn't listen, doesn't respond. And lighter, theta, tata. So lighter is theta. Now you are fallen asleep. So you are in what stage? You are in a theta wave. So lighter is theta, deeper delta, busy beta. Eye close at rest, aram is alpha wave. Okay. So first question, what is theta wave frequency? Obviously half of alpha. So it is half of alpha. What is half of alpha? 4 to 6 point something, take 7. And delta must be even less than theta. So 0 to 3 hertz. So 0 to 3 hertz is the delta wave. Now when do you see the theta or the delta? It is seen in our light sleep. Now what is light sleep? It is easy to wake up, and deep is difficult. I told him difficult. He's like dead person. Difficult to wake from. So what person is like dead? The answer is delta. So remember one more technique, deeper delta. So who's like a dead person, difficult to wake up? You say, "Arey, wake up, bhai, wake up, wake up." The problem is there. So that is the delta. Okay. And lastly, you also can say that light sleep theta wave is seen in NREM stage 1 and 2, which we'll be discussing in the next lecture on the sleep 1 and 2. And this is NREM stage 3 and 4. So now the summary is clear. Stage 3 and 4. So that is the basic idea, that delta wave are basically what? It is in 0 to 3 and light t is theta wave. Okay. So I will summarize 0 to 3. So night 0 means 12 o'clock to 3 a.m. We are all in delta sleep. Then 4 o'clock to 7 our light sleep become lighter. We are in theta. So that is light sleep. So this is, I'll write like this. This is delta wave. This is theta wave. So you are in what stage? You are in deep sleep. Here you are in light sleep. Then 8 o'clock we wake up. So 8 o'clock we wake up. Now some people might wake up early or late. Please don't tell me ki sir, but we wake up 10 o'clock. You are prince, you are king. Someone says I wake up 1 o'clock. मैंने कहा you are God. Okay, but if you wake up, most people wake up 8 o'clock. Don't ask me what time I wake up. I'm a faculty. I have no time. Okay, I have to wake up when class is there, flight is there. So for me, no time. This is what? Alpha wave. Means person is awake but pretend to be sleeping. Okay, so eyes are closed. So that's why 8 o'clock we just like you keep the eyes closed. Don't try to see anything, alarm or and that is the alpha. And once you cross the danger, 14, remember 14 is also what? Ovulation day. 14 is also what? Children day. 14 is also Valentine day. So 14 you are very, very active till 30. So that is your beta wave. Now he is awake and alert. He is now active brain. So I think now it is very, very easy. You'll never ever forget what is the frequency of the wave. 0 to 3 delta, 4 to 7 theta, 8 to 13 is alpha, and 14 to 30 is our beta waves. Okay. Now if you do a very intense activity, like what intense? Maybe explaining something to your parents when they ask you, like then you can have even more than 30. So intense mental activity, especially maths or biostatistics. So intense mental activity can cause very high frequency. Now the frequency can be even more than 30 hertz. This is called as gamma. How to remember? When you do a very intense activity like doing mathematics or maybe physics or maybe I don't know what subject, okay, clear? Then the frequency can be more, and now it is even above 30. So that's why it's a very short lasting. It cannot persist. It's very tiring. So after some time you become very fatigued, and that's why remember your mother or grandmother, G Amma, Amma's mother, grand Amma, G Amma. It's gamma, but we'll say gamma waves is G Amma. So what is more than 30? It is the Mamma waves, gamma or G Amma waves. Okay. Now let's revise everything. So frequency I've discussed. Let me discuss the amplitude also. But the point is, it's not very important, but you can remember amplitude. Okay. So write down the wave, the frequency, amplitude, and the site of origin. Or location mainly. So what is the or present? Yes, scene. Or mainly seen. So they are no different concept, but you can remember, for example, site of origin is mostly where it is seen most commonly. Like hippocampus, you cannot record from hippocampus, is much deeper, but you can say that they are originating from the hippocampus. So wave, alpha wave, frequency I told you 8 to 13 hertz. Amplitude I'll write later, so you can write 50 to 100 microvolt. And it is basically thalamocortical, या cause कर देते हैं, cause of origin, cause and origin. So cause and origin is thalamocortical oscillations. And they are seen very commonly in the parieto-occipital lobe. Parieto-occipital area. So now are you clear? So it is caused by oscillations between thalamus and cortex. You know, thalamus is the relay station to cortex. So they keep exchanging the information, and that is giving you a very relaxing wave, that is alpha, and that is thalamocortical oscillation. Origin is by the thalamic activity, but where do you detect it mainly in the occipital and parietal area. So it is sensory and visual areas mainly. That is the cause and origin are mainly seen in parietal area. Okay. Then we have the beta wave. Beta wave is 14 to 30 hertz. Amplitude is just 5 to 10 micrometer, so it's very low. So it is the minimum. So what is the minimum amplitude? Answer is it is a beta. What is the cause? It is due to basically REM. What is RE? I'm sorry. It is basically RAS. What is RAS? Reticular activating system. It's a very important system. It is related to what? Narcolepsy or sleep. So reticular activating system in brainstem. So whenever you give any stimulus, the RAS is activated, and this RAS is going to trigger your cortical activity. So it stimulates cortex and produce arousal, alertness, consciousness. So that's when coma or anything which make you unconscious, RAS is the area affected. So arousal and alertness. And it is involved in what condition? In narcolepsy. Okay, so RAS is it is defective in narcolepsy. That's why there is excessive sleepiness in narcolepsy. And what we need to do in narcolepsy, we give the drug modafinil. Why we give modafinil? Because it will activate and increase the exact, we don't know, but it increase the activity of the RAS and increase the adrenergic transmission, mainly epinephrine, norepinephrine. Then come our theta. Theta is 4 to 7 hertz. And what is the amplitude? It is around 10 to 20. 10 to 20, and it is hippocampus mainly, and we know it is related to memory also. Hippocampus, MCQ. So what is the area related to theta delta wave? It is hippocampus. Last is our delta. So delta is around 0 to 3 hertz. It is the minimum, but that comes the interesting. Amplitude is the maximum. It could be 50, 20 to 200. That is maximum, and it is seen in the sleep zones of the brain. Basically sleep zones in cortex, medulla, even hypothalamus, they generate the delta wave. Okay, so sleep zones in the cortex, medulla, sleep zone, the word is sleep zones, they induce our which activity? And our sleep zone. Okay, they produce the delta wave, deep sleep. Okay, so they are for deep sleep. So let's revise very fast. So if you are awake, let's say what wave you will be seeing right now. So right now we'll all have alpha, beta. Answer is beta wave. When you are in a break and you are resting, your eyes are closed, that is alpha wave. Or when you wake up early, you can have alpha wave. Okay, before waking also you can have alpha. Then when you start to fall asleep, like eyes are closed, you're like this. Okay, sorry. This is your light, theta. And when you're like this, and they wake you, you don't wake up, that is delta. So now very simple. So delta is deep sleep. Deep sleep. Are you clear? So I did a demonstration also. Actually I wanted to sleep, but I cannot sleep because we have to study a lot, work hard and get a very good score. So this is the summary.